Thank you all so much for being here. My name is Stephanie Olarte. I am a board member of the Women's Project. I'm honored to be here to facilitate this panel discussion today. As most of you know, the Women's Project worked hard to help pass the Reproductive Privacy Act 2019. Yeah. And I know you have been wondering what are we going to be working on next. Over the summer, we held a community meeting, surveyed our supporters, and worked with our board to craft a legislative agenda. Our supporters spoke loud and clear that they wanted to see us take an abortion ban and close the gap on health care coverage for abortion. While we were able to protect the rights to abortion last year in Rhode Island, our state Medicaid plan and our state health insurance plan do not provide coverage for abortion. And that leaves many Rhode Islanders with a legal right, but a significant barrier to access. So in starting off the 2020 session, we wanted to bring a panel discussion to highlight the need to take on abortion bans here in Rhode Island and why it is of national importance. Today's panel will provide background on what's happening nationally while giving us the context of local impact. We are joined by Jenny Brown, author of Without Apology, The Abortion Struggle Now. I would like to take the joint sponsor of this event, the collective, for inviting her here today. We will also hear from Daria, artist, activist, and the Women's Project volunteer, who uses the Rhode Island State Medicaid plan for health care coverage, which does not cover abortion care. And Michaela Arthur, Rhode Island College professor, also a Women's Project supporter and volunteer, who has a personal experience using the Rhode Island State Employee Health Plan, which does not cover abortion care. So with that, I'd like to take this moment to give Jenny Brown the mic and have her introduce herself.
Thank you, Stephanie, and thank you everybody for inviting me. I'm very impressed by all the veterans of these feminist struggles that I've been meeting. I'm Jenny Brown. I'm an organizer with a group called National Women's Liberation that has its roots in the 1960s women's liberation movement. And I wrote this book, Without Apology, partly from inspiration from the organizing that I and other people did around winning the morning after pill over the counter in the United States. This was a 10-year battle that we started in 2003 and got a favorable decision in 2013. And some of the lessons that we got from that, I think, can be applied to the other reproductive rights struggle, the reproductive justice and abortion struggles more generally. So I'll just say a little bit about that kind of as an introduction. We were counseled when we started thinking about how to get the morning after pill, after sex contraception over the counter to go for something less ambitious, to try to get it available for rape victims in hospital emergency rooms, for example. And we decided that we didn't want to do that because when we looked at our own experience in consciousness raising, we found that we needed the morning after pill, not because we had been raped. Usually it was some kind of contraceptive failure or we hadn't used contraception, but also those of us who had been raped had not gone to the emergency room. So we didn't think that program would have helped most of us. And so we created a plan to get it over the counter for all ages, which was kind of controversial because the FDA tried to divide us by age. First they said, oh, if you're over 18, if you're under 18, you'll have to still get a prescription. And so one of the lessons that we got from that is to not get divided by age or whether you have an ID or all that kind of stuff, but to really be united. And so by 2013, we were able to win that. I was also inspired by the experience in Ireland of getting the abortion ban there overturned. They repealed the ban that was in their constitution. And a couple of the lessons from them, which we should talk about, are, first of all, most of the groups had not been using the word abortion up until that time. and they were mostly going for incremental changes like allowing people to have one psychiatrist rather than two, saying that they were suicidal in order to allow them to get an abortion, and kind of small adjustments to the law. And it wasn't until they started to really demand free, safe, legal abortion for everyone who needed one that they, the movement grew and became really powerful, and then they were able to win by a lot more than they expected. They thought it was going to be extremely close. They thought they might win, but they thought it would be very close, but they really hit it out of the park with 66% of the vote. So people went door to door and really organized face to face. And then the third reason that I wrote the book is that I think that feminists today are kind of missing one of the reasons we are having such a struggle around abortion rights right now, which is that the birth rate is the lowest it's ever been in the United States. When we won Roe versus Wade, the birth rate was extremely high. Now it's kind of a sea change. And we're starting to see right-wing think tanks openly talk about how we have to get the birth rate up because we don't want to have to spend money for childcare and healthcare and paid leave. We want to make sure the birth rate is raised by other means, meaning coercion. So I talk a little bit more about that in my book, Birthright, but I think looking at this as a fight over women's reproductive labor and how important it is for our whole society, and it's been devalued and not counted and all of this stuff, but if we start to think of the abortion struggle in that light, I think we will be able to convince a lot more people that this is something that they really need to get involved in and struggle on.
Am I supposed to introduce myself? Oh, I wasn't planning on it. Hello, I'm Darren Montequilla. I'm 23. I'm from Providence, Rhode Island, and I've recently graduated from URI's theater department in 2018. Since graduating, I've obviously grown up, and with that comes lack of health care. I've recently lost my state health care, so that's probably what I'm going to talk a little bit about today and how that has affected my life. Definitely not as interesting as your introduction, but I'm just going to go ahead and pass this on.
Hi, I'm Michaela Arthur. I'm a professor at Rhode Island College and a member of the executive committee of my faculty union. And so I'm going to be talking today from the perspective of a state employee about what it means to work for an employer who is forbidden by law from providing appropriate health insurance coverage to such a large number of employees.
Thank you so much, ladies. So I'm going to go ahead and start with the questions. Daria, how has the policy denying coverage for Medicaid impacted you and the people that you know?
Well, recently I've just lost my health care coverage from the state, which means I used to be blessed enough to have dual coverage with Blue Cross and Medicaid, but now I am down to just my Blue Cross, which is only through my father, and since he's pretty absent in my life, it's going to go away once I hit the 26, I think the age is now. So that's something I've been worrying about, because while I've had dual coverage, I was able to get birth control pretty easily. I didn't have to pay any co-pays, but now that I only have one insurance, I am paying co-pays, and I have to choose between paying co-pays for the medication I need to keep me from being mentally stable, or if I want to have birth control. And right now I'm kind of at the point where I need to just pay for the medication to cover my depression and my anxiety, because I can't necessarily afford to pay co-pays for both of those things. And I'm just now realizing I'm not going to have a lot of money to pay for my co-pays for my gynecologist appointments, because now I have to pay co-pays for my therapist and my psychiatrist, and those are already really putting me at odds. And when I tried to get my healthcare reinstated, they told me I made too much, which is, I'm living paycheck to paycheck. I made about $14,000 a year right now, and that is apparently too much to have healthcare coverage. So now I'm just kind of living in fear all the time, and I'm having to choose between, do I want to protect my body and my reproductive organs, or if I want to protect my brain. And that's kind of really scary to deal with, especially since I've recently moved in with my boyfriend, and I'm 23, and I'd like to live the life of a 23-year-old, but I'm definitely walking on eggshells more than I was before. And yeah, just getting broker every day.
Thank you for that. So Michaela, how has the policy denying coverage for state employees impacted you and the people that you know?
So, first of all, the fact that state employees don't have abortion coverage is actually a relatively well-kept secret. Many of my colleagues don't know that they don't have abortion coverage until somebody tells them, or until they or a family member needs abortion care. Now, technically, there are 3 circumstances under which abortion coverage is provided, according to the website that I looked at for my health insurer. Rape, incest, or, quote, where the life of a woman would be endangered. Note, this language does not provide abortion coverage for men whose lives are endangered by pregnancy, which, as surprising as it may be to some people, is a real circumstance that does occur. And imagine having to prove to your health insurer that you were raped in order to get your abortion covered. So what this means is that in the midst of some of the most difficult moments of their lives, my colleagues discover that they're on their own. I personally am privileged enough that I have the financial ability to cover the cost of an abortion if I had to, but many state employees don't have that privilege. Many of them are among the 39% of Americans who would not be able to handle an unexpected $400 expense, right, without facing significant difficulty. And they have no idea that this is the situation that they could end up in. In terms of my personal situation, I was born with a genetic condition called Stickler Syndrome. This condition is a deficiency in connective tissue that affects my entire body, causing progressive deterioration in joints, hearing, and vision. Some people believe that it is one of the leading causes of inherited blindness. It's transmitted in what's called an autosomal dominant pattern, which means that 50% of the offspring of any person with Stickler syndrome will be born with that condition. What that means is that I would not bear children without pre-implantation genetic diagnosis to ensure that I did not pass on this condition to any child that I had. Were I to become pregnant without pre-implantation genetic diagnosis, I could not bear the thought of having passed on that legacy to another generation. And of course, a pregnancy could be dangerous to my own health for various reasons, causing risks I wouldn't want to undertake. So far in my life, I've been lucky enough to avoid unintended pregnancy, but I know that's just luck. And none of us should have to live a life in which every time we have sex, we have fear of whether that's fear of the financial consequences, whether that's fear of the physical consequences to our own bodies, or whether that's fear that we would be forced to bring into being a life that we know we don't want to bring into being.
Thank you, ladies. I want to go back to you, Daria. How does the lack of coverage through your insurance impact people's profession and professional choices? So I know that you right now are having a difficult time because your coverage was taken away. So talk a little bit about that in that context as well.
Well, since I found out that my health care is not going to be reinstated, and that I don't have dental coverage, which I also found out about in the same month as I cracked a molar in my tooth and I thought I was just going to get it fixed. And then I went to I got a small filling and they were fine. And I went to go get a root canal and they told me I didn't have any coverage. And so my dentist is now they're going to have to bill me because I didn't have coverage and they didn't stop me, they didn't speak to me about it. So now I'm living in fear that I'm going to have an abscess in my face. So that's just really scary. And so since this is happening, I've started to really think about my career choices. So I've been interviewing with different places, hopefully to hear back soon. But it's kind of really unfortunate because I really do love the place where I work right now, and I graduated as a theater major, so they were really flexible with their hours. They allowed me to do what I'm passionate about. But in my interview I had a couple weeks ago, I literally told the person, because she knew about my theater background. She was asking about any schedule problems, and I told her like I was willing to put theater on the back burner, even though this is what what I've spent thousands of dollars on, what my passion is, what I've dreamt about my entire life, that I was going to have to not do that because I really need to get serious about a job that's going to offer me more. And I obviously didn't say I'm just doing this for the health insurance, because I do want better, career experiences, but a lot of it was like I was really pushed because I'm really nervous about not having health insurance and dental insurance, and really don't want to get a tooth pulled, and I really don't want to have to run into what I would do if I did have an unexpected pregnancy, because I do live with my boyfriend. We're pretty happy, and I don't have birth control right now. So pretty much I'm just looking for jobs that is definitely going to limit me from doing what I love the most. And that's just a really sad reality, because I spent years and thousands of dollars to act, and now I'm not gonna have the time. But hopefully it'll work out.
So from my experience as an academic, it's somewhat unusual in terms of a profession. Academics have very little say in where we end up living if we want to be employed in our profession. In some academic subfields, there may only be a handful of jobs in the entire country in a given year. And so you end up where you end up. We don't have the professional option to therefore say, this employer isn't giving me the benefits I want, let me find another one. The calculus may be slightly different for other state employees who could go off and find a job somewhere else, but because of the structure of retirement benefits and seniority and various things that are built into state employment contracts for most rank and file state workers, the choice to take another job means actually foregoing substantial benefits, including really what they've taken on as part of their compensation for the years that they've worked. Those are, of course, enormous privileges that state workers have, but nobody should really be having to give up things, right, in order to get access to health insurance coverage. None of us should have to forego abortion coverage simply because of where we work and because of the ways that our careers have unfolded.
Thank you. So the question that I'm going to ask is for both you, Michaela and Daria. So right now we are starting our session, and our hope is, getting education out on this issue and having the ability to hopefully pass it. But obviously this is going to take a lot of work. What is the feeling that you get knowing right now that this is something that Rhode Island is going to be working on, and how do you particularly feel about volunteering and getting the word out yourself as someone that is affected by this issue?
Well, fear would definitely be my number one word, but we're doing pretty good things, so I don't know. I just really don't know what to say. I'm just really scared, and I think that's what drives me, and I don't want to just say I'm pushed by fear to volunteer, but I really am, and I'm not only afraid for myself, but for my sisters and mothers and all the women around me. Hold on, you just take this.
So one of the things that's really interesting about both the campaign last year and the work that we're going to be doing this year is how much of a surprise it is to so many people that in this state that they think of as blue, that they think of as liberal, that they think of as progressive, right, that these rights are unprotected. And so one of the things, it's just been really interesting to me to have those conversations with people, including members of my own faculty union, and say no, we don't have that protection, we don't have that coverage, look in your insurance documents, right? People are really surprised. And so, having the opportunity to get the word out, to help people start to understand the situation that we are living in, and then to build power towards making a difference so that nobody in the state is in that position, which of course is much broader than just this issue, right? We can't stop with just changing health insurance coverage for people who have Medicaid and for state employees, because there are still lots of people who don't have health insurance coverage at all, and because just insurance coverage isn't enough to make sure that people have the autonomy to make choices about pregnancy and parenting. right? But at least we can work this year on making that first step to reduce the number of people who are faced with this fear that they aren't going to be able to have the coverage that they need.
You both just, did something really hard, right? There's a lot of stigma around Medicaid. There's a lot of fear surrounding on talking on the issue. So I want to thank both of you for being able to be fearless and having that conversation and telling your story. That being said, Jenny, I kind of want to go to you and say, how does the personal experience of these women tend to trend nationally? And have you noticed national trends related to how abortion coverage and healthcare impacts the choices one has in a job, professionally, and so forth?
Yeah, well, there are studies that show that in states where there's more reproductive rights access, women are paid higher. Of course, there are a lot of other compounding factors, so we don't necessarily know. But we do know from our own lives, as Daria just testified so beautifully, that healthcare in general and reproductive rights in particular, if we have those under control, it means we can take a leap, do other things, maybe be not afraid to change jobs. And these decisions around jobs and even around marriage and around healthcare are definitely constraining our ability to change jobs, leave a marriage, get married, retire, all of these things which should be human rights that we decide on based on other factors than whether or not we have health insurance. I know my experience was that when Obamacare was passed, it did allow me to leave a job that had health insurance and get one that didn't have health insurance, but the deductibles were very high. That was fine as long as I was healthy, but then when I was diagnosed with breast cancer, about the time Trump was elected, which I associated to, I then seriously looked at, gee, maybe I need to marry the boyfriend that I've been living with for several years because I could get health coverage that would be more comprehensive, because I ended up $7,000 out of pocket for 2 years running, first with the breast cancer surgery and then with the follow-up treatments. So I'm sure all of you have family members, or you yourself can think of ways in which our healthcare system and the reproductive rights part of it have distorted what we wanted to do and with our lives. So I think that's really, and I'm a big advocate for Medicare for all. I think it would be a giant feminist advance not to have to worry about healthcare when we think about jobs and marriage. The whole idea that we would be pressured into marrying to get healthcare, as I was. I feel very happy to be married, but I would probably not have taken that step without the requirement of healthcare. So I think it's a big feminist. It would be a great feminist advance if we could get the same kind of healthcare that people all over the advanced world have, and people in very poor countries have, because their governments have made it a priority to make sure that everybody in their society has health care.
It's very hard sometimes to speak up about Medicaid. I used to have Medicaid as well, so being here and having a discussion, I know it can be a little scary. So Daria and Michaela, I kind of want to know, you both just said so much to us, right? And you educated us a lot in your lives on what your story is. But I kind of want to know how you feel at the moment in front of so many people, having to share that. Because it's emotional, it's a situation that not everyone gets to do. So how do you feel being here and having to have that discussion that, yeah, I'm Medicaid and this is something that's happening to me?
Honestly, I was really nervous, as you can probably tell, But every time I get into my personal story, I'm looking at you guys and everyone's like nodding or just like, oh, I can't believe that, because like you've all been there, and that was just really touching to me. And I really appreciate this experience, because it's definitely easy to feel alone when I'm like making those calls and the woman's like, no, you make way too much, and send me your pay stubs, and you're just like, I don't know what to do. I just started to be like financially responsible for myself. Actually, that's not that true. I've been financially responsible for a while. I just started having to make these calls myself, and that's very scary. But yeah, I really appreciate that you guys are just here and that you guys support what's happening, because healthcare coverage is a really scary topic to deal with, and I've only recently started to really understand how important healthcare is to me and what it's going to mean for the rest of my life, because since I've had dual coverage, I haven't had to really worry about it until like it just started piling on this year, and it's like kind of a scary road, because I do have like some chronic stomach problems that I'm going to start needing to be taken care of once I get this new doctor in March, and I don't know what their co-pays are going to be like, and I just really don't know. It's been like a battle for my whole life trying to figure out stuff wrong with my body, and now that I'm going to have to pay out of pocket for it, I really just like, I don't see a solution anytime soon. And you guys are still nodding, and that still makes me feel really good, so thank you guys so much.
Telling these stories is hard, but it shouldn't be, right? Our society continues to stigmatize not only people who've had abortions, but people who use public health insurance and people who experience disabilities and chronic illness. We're currently in the midst of federal litigation over the provisions of the Affordable Care Act that ensure that those of us with pre-existing conditions can access health insurance, and there are still not strong enough protections against genetic discrimination and disability discrimination. Right? And so when I share my story, I'm conscious of the fact that telling it could change the way I'm treated personally and professionally. And that makes doing so hard. But it's also what makes doing so really important, right? So for all of us being willing to have these conversations and tell our stories is part of the way that we work towards destigmatization. It's the fact that so many of us are so reluctant to tell our story that enables people to wear blinders about how common the experiences are, that we all know they happen, but so many people don't. And in fact, the history tells us that stigmatization has in some ways been more powerful than criminalization even in deterring people from access to abortion. So we need to return to a framework of liberation that helps us get beyond that. But we need to do it better than prior generations did so that we can care more about reproductive justice more broadly, right? Because that's really what in this conversation, we're not just talking about access to abortion, we're talking about access to healthcare of all kinds. We're talking about access to autonomy and making decisions that are about our bodies and our childbearing, which are rights that people with disabilities often don't have. Right, and so there's so much more there, and it's not until all of us can start to share our stories without so much fear that we can really make some of the progress that we need to make.
So thank you for that. I'm really glad that you spoke on disability, because that is true. We have a lot to say on that issue, but because that's probably another panel, we can talk about that another time. So with that, I want to kind of go back to your book, Jenny. You discuss pivotal points in personal storytelling, which is partially one of the most important parts for me in that book, and how that impacted the movement. So while we're really honored that Daria and Michaela were able to tell their stories and really share that with us today, it also feels like we're asking them to share a piece of themselves that do we really need to always be hearing? Do we have to have people always tell us these stories in order to make moves? So alternative to that, I kind of want to also add, what does that have? How is that the difference with the way that we do things now? Because white women in general have an easier time speaking about these things, and women of color sometimes are stigmatized a lot more than white women when we're sharing stories. So can you talk a little bit about how that has been an impact in your research, and how you wrote about it in your book as well, and what we see trends in nationally?
Yeah, so I start the book with with the breakup of a reform hearing by the Women's Liberation Movement, and then the Women's Liberation Movement, this group called Red Stockings, conducted the first ever abortion speak out where women got up and talked about their illegal abortions at a time when it was still illegal, so presumably you could be arrested and asked to reveal who was your doctor and so forth. 20 years later, they did a speak out in 1989, and it was very interesting. One of the testifiers, Roz Baxendall, said it was easier to speak out in 1969 than in 1989 because she felt that she had the movement around her. She felt she had movement sisters who would be there. In 89, she felt much more isolated. The movement had dissipated, and it was much harder to speak out. So I think this is a lesson for all of us, that for people to be able to get up and speak out as they did in 1969, we need to have a strong movement. We need to be there for our sisters and siblings. We need to think about how we can support people. For example, Amelia Bono, who inadvertently started the Shout Your Abortion movement with her abortion testimony, had to basically go into hiding because she was attacked so viciously online and had so many death threats. But it's not just horrible strangers, it's also your own family, extended family, people in your church, folks in your community. When they hear you had an abortion, it's like, will the stigma hurt your kids? Will it hurt your family? You can be stigmatized very easily, so we need to be a support system for folks who do speak out, who feel the strength to speak out, and that makes it easier for everybody else to speak out, and the more and more until we can break through that stigma. And it definitely hits women of color more because there are all these horrible stereotypes that women of color are sluts, or women of color are having too many babies, or what, all of these things that we're familiar with. So for women of color, we need to be even more supportive and make sure that those folks are safe when they're speaking out. So I think that's part of it. And then the first step that caused the Women's Liberation Movement to take on abortion was really talking, not publicly, but speaking to each other, speaking among ourselves about abortion, and discovering that so many people had had abortions and had never told anybody, right? So you don't have to get up in a big crowd. You can just share it among your friends and talk to women that you know are going to be supportive. That's the first step. And so then they get strength from your testimony, you get strength from their testimony, and you really get more of an assessment of the condition of women, which is the idea with consciousness raising, is you would take all of those specific experiences and generalize it into what we need and want for our political program and what we need to demand in the public arena. So even if you don't feel quite ready to speak out to strangers, it's important to talk to your friends. And this was one of the really powerful things in the campaign in Ireland, where people went door to door and talked about their experiences with abortion and asked each other about their experiences with abortion. And so many people had had abortions, but they hadn't told anybody because it's illegal in Ireland and you have to go abroad, or maybe you got pills in the mail and took them. And so it was extremely powerful. And when the vote happened, they asked people who voted what was influential to you in your vote, and hearing people's stories was one of the big factors, and those people were much more likely to vote for repeal. So I think that's an interesting thing too.
Thank you so much, all three of you. So right now I just want to open it up to the audience. If you have any questions for Jenny, for Daria, or for Michaela, feel free to ask now, and we'll do a few minutes of questioning, and then we'll go ahead and close the event.
This is not a question, but Thanks. My name is Clara, and this is just a comment on Medicaid. I'm a Medicaid provider, I'm a social worker, and besides myself, there's not a lot of qualified people that accept Medicaid, so I have a lot of clients that are scrambling around trying to find Medicaid providers. And the reason is because we're not reimbursed very well, so people don't want to take Medicaid because of the reimbursement rate, which, is bad. You don't get paid very much to be a Medicaid provider. So looking at Medicaid reimbursement rate is something that should happen too, to get more qualified, better providers to meet the most vulnerable population.
Yeah, I just have a comment. The experience in Illinois is important to look at because they did get Medicaid coverage, and then because the reimbursement rate was so low, one of the clinics actually went out of business because they had to provide so many. So we need to look at that particularly. Yeah.
Question, but I don't need a microphone, I'll speak loudly. And probably
stand,
please? My name?
Stand.
Oh, Stan. My basic question is, how did it get left off? Why isn't it covered? Like, who made that decision, and why is it the way it is?
White
That's
men.
my question. Well, I know that they don't want.
So Jenny, because of that question, I kind of want to ask you something. Medicaid did cover abortion for a while, is that correct? When Roe?
Yes.
So can we talk about that?
Yeah. So when Roe was decided, for the following 3 or 4 years, Medicaid covered abortions nationally. All abortions were covered, and that was ended with the Hyde Amendment, which it's very interesting when we think about the Democrats and Republicans and how they've divided now. Ford said he would not sign it, and it went to the next, so this is 1975, the 1976 election, right? Ford versus Carter. Carter staked out a position that he would sign this ban on abortions through Medicaid, and then he did, and he even said, well, there are some things that aren't fair in life, when asked about it by a feminist journalist. Oh, some things in life aren't fair, especially when there's a moral question involved. So that was his famous quote when he signed the Hyde Amendment. So the Hyde Amendment restricted all, and it's always attached every year to the budget, and it restricts all federal funding to abortions, right? So that's not just that's the Indian Health Service, that's the military hospitals, federal prisons, and people who get their health care under Medicaid. So various states in response, not really in response, we did it, right? We campaigned in various states and won Medicaid coverage for abortion in various places. So California and New York, for example, cover it. And then some states cover it in certain circumstances and whatnot. So that's the history of how it happened, is initially a third of the abortions in the country were covered. That was great, people could actually get access for once. And then we immediately went backward, and that it was passed in 76 and became effective in 77.
I believe, like, in terms of state employees, it was also true that abortion was covered at some point and was changed. So I was just wondering, how did that happen?
I'm going to bet that is state by state.
Don't talk about Rhode Island.
And I don't know the Rhode Island case. Do you happen to know? Does anybody have a sense of this history?
My guess would be that it was a bargain, because is anybody aware of a state law that prohibits?
Yes, it is prohibited.
By law?
Yeah. Yep. It is prohibited by law that our coverage include abortion. I don't know when the law was passed. I've only lived in Rhode Island for 12 years. I know it was before 12 years ago, but it is prohibited. So that is not, because otherwise, right, because most state employees do collectively bargain our union contracts, otherwise we could bargain it into our health insurance, right, but we cannot because it is prohibited.
Somewhere over 35 years ago, it was, because I was a state employee then, and I know I left in 85, and so it was before that it was available.
Well, I know that would be a fascinating history to uncover for this campaign, right? I mean, somebody might want to.
I know that there was a change in 2016 to Caramano actually looked at the budget in 2016.
So that's about the exchanges, not about the state, right, not state employee. Ours has been the same. Yep.
Do you want to? Anybody? There we go. See you.
Oh, yes. Do you need a mic?
This is a comment. I'm a volunteer for the Women's Health and Education Fund in Rhode Island. And we're a fund that raises money and disperses it for women who live in Rhode Island who want to have an abortion but can't afford it. Also contraception. And I thought I'd just have a little information for them. Last year, or the last fiscal year, we helped for abortion 350 women. And of those 350 women, the average cost of the procedure was $870. Now, the minimum cost for those 350, the minimum cost was $443. That's the minimum. And the maximum was $11,500. Because if you had, some of these situations, when you get into the reality of it, there are women that are finding out late in their pregnancy that there's a serious situation, and those are expensive procedures that, by the way, aren't done in Rhode Island. That's the other thing. You've got a complicated situation, you're not having it done here. The most common charge was $600. So, that's not nothing.
Right.
And I'm passionate about this fund and working for this work, but this is not the way to fund. This is healthcare. We need to work on this.
We have time for one more question, if anyone has it. If not, I'm going to wrap up. We're good? Yep.
Well, so are we going to talk about how we're going to try to get this changed? Is that where we're going next? I mean, it's a law, right? So we have to try to get that law changed. That's the answer, right? Okay. That's what we're working on this year?
Yes.
Okay.
Thank you, Daria. Thank you, Michaela. Thank you, Jenny, for being here today. I really appreciate you telling your stories, and Jenny giving us so much to think about, giving us the history of abortion, as well as telling the storytelling portion of the meaning of that for a national trend and how it actually can be really impactful for our state of Rhode Island. Yes. I want to thank all of you for being here today. It's really important that we get this out to people everywhere, your friends. It's really important that we start working on this issue and educating people, our communities, and that's a big part of what we want to do. And so with that, I want to say that listening to everyone's concerns, the Women's Project for 2020 session is going to be talking about this issue. It's going to be working on putting a policy that we can start, getting the word out and hopefully changing. We got the RPA, we can get this too. No matter how long it takes, we're going to continue doing this fight. We work hard, right, to protect abortion, but a really important part of that is really access. want to make sure we have the access to protect abortion, to have women be able to go and do whatever procedure and make any decision that they like themselves. Regardless of income, regardless of insurance, because obviously we see how much that is impacting us today and in our state. So there will be many places to get involved during the next few months. We have tons of events that I hope you all can attend. We will have a lot of learning workshops and things happening around, so please keep an eye out for that. Jenny's book is right there. If you guys want to purchase it, feel free to do so. It's really good. I also want to help us, advocate together. We will have a lot of announcements on our newsletter, on Facebook. There's a bunch of trainings that are happening that we are also involved on that I would really love for people to attend. And I just want to give you all a round of applause. Give yourselves a round of applause for being here. Thank you, ladies, for being here today as well, for telling your stories. I know how fearless you guys are today, even though it kind of worried you a little bit about being able to tell that. So thank you, ladies. Thank you, audience. Thank you, everyone, for being here today. And this is only the beginning. The session just started today.